to the fabulous El Dorado County. I am very excited and fortunate to introduce our spotlight presenters. We are joined by Tim Hooey, Program Coordinator, and Stephenie Carr, who is a Certified Wellness Coach 2 of El Dorado County Office of Education. The EDCO team will present on their CWC work related to scope of services, supervision and training, and sustainability. After the presentation, we'll have some time for Q&A. And with that, I'm going to pass the mic to our presenters, Tim and Stephenie. Welcome.
All right. Thank you, Desiree. Much appreciated. It's really good to be here with everybody. It's a lot of familiar faces and a lot of folks that I've had a chance to work with in the past and miss working with today. Always want to give a special shout out to Patrick. I learned a lot about gentleness and care within a therapeutic relationship from Patrick, and think about that often still today. So miss all my time there at SCOE, but I am a mental health and wellness coordinator with the El Dorado County Office of Education. Prior to this role, I was a clinician on a school campus working mostly at middle schools, but at a middle school and high school campus. I'm a licensed marriage and family therapist by trade, and now get to do a lot of work with our wellness coaches as well as our career pathway work. So working with peer advocacy, wellness coaches, building relationships with our local community colleges, and thinking about how to increase our mental health access in El Dorado County. I'll tell you a little bit about our wellness coaches, but first I want to give Stephenie just a second to introduce herself.
Yeah, hi, I'm Stephenie Carr, obviously. I work at a middle school as a wellness coach, and I've been in this role since December 1st. So I'm, really excited to share what we have going on.
Great. Thanks, Stephenie. So really quickly about El Dorado County, and Desiree set this up well, that we're going to kind of just walk through what are the scope of services, what we've learned about that, and some of the challenges there. I follow that up with what we've done in terms of our supervision and what we are thinking for sustainability. All of this is a work in progress, as all of you know, because it's just brand new work. So if you don't know El Dorado County, please come up. It's beautiful, and we've got Tahoe, we've got Placerville, some great trails. We are pretty large geographically and fairly small in terms of our student count. We have about 30,000 students, and that is over 15 different LEAs. Many of them very small LEAs, one to two schools with 400 students or less. So a lot of our campuses don't have this kind of support that the wellness coaches bring, and haven't had that type of support. They rely a lot on community organizations, and just their school staff. We currently in our county have about 26 wellness coaches, at least that I'm aware of. All of those have started that work through the employer support grant through HCI. So I don't think anybody from HCI is on here, but huge gratitude towards HCI for the work that they've done to help support us. That helped get us started this year. Within EDCO, currently we have 5 coaches. They're spread across 6 different school sites. And it's 6 school sites, but it's really kind of 5 school sites. One of those school sites is a middle school on one side of the property and an elementary on the other, but very close together. So we've kind of intentionally left our wellness coaches all on one campus and tried to make sure that they can really be a part of the system itself. I know it was a frustration for me at times as a clinician to be spread across multiple campuses and not feel like I could really, ingrain myself within the culture. So we've tried to make that a point within EDCO to make sure that they are on one site each. And the other part of their schedule that I'll mention before I hand it off to Stephenie is that our process in EDCO is having our certified wellness coaches on school campus Monday through Thursday. So that's during the school day. We don't see them really at all Monday through Thursday. And then on Friday, everybody's in-house at EDCO. So that's when we do our supervision, when we do our training, and I'll mention a few of those other pieces of the puzzle. But again, we really felt like keeping them on one site in a consistent Monday through Thursday manner was a really important thing for our El Dorado County schools to build trust and to make the most use of a person being on a campus. So that's a little bit about our schedule. That's how it works. I want to spend most of our time really kind of handing this off to Stephenie. She's going to talk a little bit about what her experience has been like on the campus, fulfilling her role. And if she doesn't get to it, I'll certainly mention a little bit of the challenges as we have started this work of defining the role of a wellness coach, particularly compared with a school counselor or a clinician that's on campus. So I'll pass it off to Stephenie to kind of talk about the actual day-to-day, what that's looked like and how it feels.
Well, yeah, so let me just jump right in. I know on the slide here you have these three different categories that we fill largely, and I'll just kind of fill that out a little bit. So as far as the direct support individual wellness coaching sessions, a lot of what that looks like is any anxiety regulation, coping skills that kids might walk in with. Some of that direct support, or that individual support is just like, they'll walk into the wellness center, walk in, they're having a bad day and they need a moment. Some of that is peer relationships as that's flaring, whether it's during break or something happened during class and they just need a moment to talk that through and strategize like how to get through that. Some of it is that goal-based support. So these might be more of like the referrals that we have for one-on-one engagement with students, and just helping them with skill building practices. So that might be behavioral changes. So a lot of what I work really closely with, I'll get into this in a little bit, but I work really closely with the assistant principal who does a lot of the behavioral management. And after a student has kind of gone through whatever the disciplinary process, the protocol is, they might have them meet with me and come up with skills or strategies for how to avoid that behavior in the future. And so we get into like what kind of led there in the first place, or the motivations, how can we handle that differently? Let's strategize. And that's been really rewarding. I think my favorite story in that is we have unfortunately had a lot of, in the last, I'd say 2 months, just a real increase in some of like the racial slurs or, derogatory gestures. And so after they've gone through that process with the assistant principal, they will be referred to me to sit down and kind of have this non-judgmental space where we've been able to talk about, like, what do you understand about that word, or what do you understand about that gesture, and how does that how did you come to use that in that way? And as a way of addressing, like, what damage did that cause, not only to the individuals that might have been targeted, but what damage does that cause to our school community? And my favorite story was one student in particular, just emphatically committing to making sure that his friends knew after that point, that what that meant, and to intervene at any point after that. And it's been really great to be in a space where students are given the freedom to engage, not just like in this pejorative way, but like to engage in with the actual, like the harm that they might have done, and even unknowingly. So that's been a really rewarding one. Another one has just been building trust back with teachers or parents after they've had behavioral challenges, maybe been suspended for a few days, and how do they come back and build back in a positive way instead of just continue to spiral down negatively. Another way that we've engaged with individuals is through executive functioning skills, helping students with specific goals like organization or focus, and then just building positive school connections. I know our school has really been struggling with increase in absenteeism, and so building those connections and helping students strategize or build upon the connections that they already have has been really big. And then as far as group-based building, skill building, that would be like executive functioning groups, friendship groups, conflict management. We've had a group of students that were struggling with substance abuse, and so coming and wrapping around some support around them. And then as far as the crisis stabilization and immediate triage, like, again, that's that panic attacks and students that are having family emergencies can't engage in class. So a lot of the reasons that they would walk into a wellness center, or maybe those heightened behavioral incidences that we mentioned before. As far as advocacy and climate, again, this is that tier 1 conversation you guys just already had. We're just promoting our wellness center. We have Wellness Wednesday activities that we do school-wide in the library. That we have an SEL program. On Fridays, our principal puts together something, and they've invited us to help inform what those things are. They've given us the template and said, okay, create us some. So that's been a positive way to engage with the whole school. And then developing peer advocacy programs. Our school has a Safe School Ambassadors program and other student-led clubs. So just giving that advocacy back to students and letting them use their voice for positive change on the school campus, but being a part of what's promoting that and helping facilitate that and helping students recognize their strengths in that has been big. And then reducing the mental health stigma on campus. Our school participates in the National Counseling Week. We have our wellness center that we promote, those kinds of things. But the collaboration with teachers and staff is really probably what's been key to a lot of this being successful. So again, with the teachers and the school staff, they all have grade level expectations as far as executive functioning skills go. And so as we're working with students, actually understanding what those specific expectations are so that we can come and support those has been big. Those where a lot of our referrals come from. So the teachers are recognizing us as a positive influence. And then again, with that assistant principal and the behavioral issues, that's been a good collaboration as well. And then as far as family outreach and resource navigation, especially with the absenteeism, working with parents to kind of, before it gets to chronic absenteeism, work with them at that acute level and help them understand like what is keeping student from school. What are you doing as parents? How can we help like empower you to maybe make some different choices, even if it's anxiety related? How do we help support a student through that? And then of course, like working through insurance and getting the supports that they need. And then coordinating with the mental health teams. If we go to the next slide, I can talk about that one a little bit more in detail. It's really important for us to understand our scope, and it's also really helpful to know where we can overlap. So for instance, where a wellness coach focuses primarily on the prevention and early intervention, again, that school connectedness, maybe it's wellness practices, maybe it's helping students recognize their options of choices that they might have in a situation, or skill building. A school counselor is going to be focused on that whole child development, academic success, career readiness, social emotional success. And where the lines maybe blur a little bit is like some of those, we could all be leading groups that kind of address some of those things. But if I can lead a group that a school counselor who has a different level of expertise and needs to focus maybe on some more of these other tasks that they have at hand, it frees them up to do those things, and I can take some of that burden off of them. And then, of course, the licensed clinician is going to be focusing on those mental health treatment within that school setting. And then as far as direct services go, again, I can be focused on stress management, coping skills, self-reflection and assessment, whereas the other roles have very much a different role in that. So the school counselor would have the short-term guidance, crisis support, academic planning. The licensed clinician would have clinical treatment and therapy groups. Where the limitations come in, I always kind of say like what I'm not, right? So I'm not a therapist or a counselor, but I can affect mental health positively through regulation, coping skills, regulation practices, wellness practices. I'm not here as a disciplinarian, but I can be influential at correcting behavior through alternative relationally based interactions, calling students to a different set of skills, restorative practices. I'm not a teacher, I don't give grades, but I can impact a student's academic success through skill development or strength-based interventions. So it's helpful to know what I'm not, but it's also helpful to know how I can impact some of the same areas that we're all working towards as far as our goals are.
Great, thanks, Stephenie.
Yeah.
So I would say Stephenie's done an amazing job going into her system and making sure that she's connected with the staff. She's working well with the staff. But this has also been a huge challenge for us across the board, bringing in a new position that not every school staff understands or trusts yet, or understands that what their role is. So we've had to do a lot of clarifying throughout the year, both with admin and with teachers, as well as school counselors. So it's been helpful for us to have a little bit of a framework like this to walk in with and say, here's what we can do as wellness coaches, but here's what Stephenie said, here's what I'm not, here's what I won't do. That's been a pretty constant conversation. And I would say probably the biggest challenge of jumping onto a campus, especially as an outsider. Want to speak just a couple minutes to supervision and training, and then I'll wrap it up with how we are seeing sustainability. Our supervision all takes place with myself or with another coordinator, Leslie Bauman. We're both licensed marriage and family therapists. So it's been important for us to have a licensed clinician in that supervision role. We do meet every Friday as a group. That time is a lot like group supervision, for an intern or something like that, where we have a wellness coach every week do a case presentation where we talk about a student that they're working with, and then we have a different wellness coach do an intervention presentation so we can all be learning from each other. We've really tried to push being collaborative in this process, and again, that's part of why we have our Fridays together. We also do some individual supervision, I would say probably roughly about every other week, but really the Fridays together is kind of the big push for supervision. While our wellness coaches are here on Fridays, they work on supervision, writing notes, prepping for the following week, collaborating with each other. All of that is built into our Friday. Part of what's built in is also our professional development. So just a few things that we've highlighted. We've really made a push to have everybody trained on restorative practices, conflict mediation, and motivational interviewing. We will probably do something similar next year as we are training our wellness coaches. So we'll have 3 days together countywide with all of our wellness coaches at the beginning of the school year where we will do some of those trainings. Last thing I'll say is our idea of sustainability. This is our version of throwing spaghetti on the wall. We don't know yet quite what's going to work or what's not. We've just started billing through the fee schedule. We have an EHR called Smart Care that we're using for that. But we haven't had an employee in here for a full year, so we're still trying to piece together what this will look like. What my idea of it here is that as a 10-month employee, this is potentially what we could expect. I'm being a little bit Pollyannish, I think, but this is, I think, what we could potentially get to. I've added case management in here. I know that it is not currently part of the fee schedule. This is both my wishful thinking and also trying to anticipate what is going to be coming if wellness coaches are able to bill for case management. I can see a combination of the fee schedule, and for us, it's really pushing into enhanced care management. We're working with a couple of managed care partners right now to get through that process of becoming providers for wellness coaches to continue doing the work they're already doing, but get paid for it through that system. So I'm happy to answer questions about what that process has looked like for us. So we think the combination of those two things gets us close to a sustainable position. Last thing I'll say on that is we also have a couple of grants that help support our wellness coaches. Really encourage everybody to reach out to their managed care plans to talk about that. We've done a lot of work through SB HIP to build those relationships. And now we've been able to leverage that, at least with Mountain Valley Health Plan, which is San Joaquin Health Plan. And they provided a grant for us for another 2 years of being able to have a ramp to figure out if we can make this a sustainable position. So I think that's a great place for people to reach out if they're looking for these sustainable places. 2 other quick things. One would be, I mentioned we're using an electronic health record. All of our wellness coaches also have a Google Sheets that they've been able to track their services on. I think somebody will hopefully throw that in the chat for you if anybody's interested in that sheet. It's a way for us to keep track of what's been going on. We used that up until we started using our electronic health record. And then very last thing I'll mention is, the still one of the struggles is with our wellness coaches trying to piece together how do we claim medical necessity and what does that look like. So we have things like class-wide presentations listed on here. I have that factored in at 15 students per class because I'm not sure we can justifiably claim 25 students or 30 students have medical necessity right now. We are working with a couple of universal screeners to try to figure out if we can use a universal screener to claim medical necessity and have that entered into our health record, so that all of our students potentially could be billable. But that's definitely an area of need that we are still working on and trying to figure out kind of in real time, having conversations about that every week. So that's it for us. We appreciate having an audience. I would love to answer any questions if you have them. I think we have a few minutes for that. And also would just offer up, Stephenie doesn't know it, but she's about to offer up Stephenie or myself to answer any questions you guys have. So please feel free to email either of us. We love collaborating and learning from other county office of eds and people that are doing this work, and hopefully we can share in that as well. So if there are any questions, I'm going to keep my screen up, but I'm not sure I'll be able to see anybody. So maybe Desiree or somebody else, if you can help me see if there are questions.
For sure. We appreciate both of you. Thank you so much for sharing your structure and your development with the CWC work. It's always good to have a lens inside our local partners in this work. So thank you so much for sharing. We're going to move into Q&A right now. And if anybody has any questions, please feel free. We can go ahead and use our raised hand feature, and we will go in our conga line for Q&A.
I'm going to stop sharing, but I'll put our email addresses in the chat just in case anybody wants that.
Any takers? I will start us off if nobody minds. I had a question. I heard you say that, Tim, I heard you mention that you have found yourself in a space where you're educating educators and other like site admin on the work of the certified wellness coach. And I guess I'm curious to understand how frequently you're doing that and what that looks like. If it's, via email, have you found like an open-ended Zoom, 15-minute Zoom? Like how have you set that up? What has been your most effective way of
Yeah,
sharing
it's
that
a great
information?
question. I would say that it's sort of what's like the clinical words, titrated a little bit, where at the beginning of the year, there was a lot of in-person communication, visiting the admin on site, making sure that they understood what this role should be. Also doing a lot of work at the district level with any coordinators or directors that were involved in student services. So from the county office of ed standpoint, that was probably most of my communication was with the district level staff, making sure that they understood it. And then they would then continue that conversation with their principals. I think probably we've shifted that. How often that happened? I mean, right away, probably for, I don't know, that was probably a weekly conversation on some sites and a monthly conversation for a few months on others. As things have shifted, that slowed down, but I would say probably the responsibility and burden of that has shifted from me to our wellness coaches on the ground being the ones that are doing that education with the school staff and the school administrators. So Stephenie, you're in a system that I think actually probably gets this more than others. I don't know how often you have that conversation.
Yeah, no, I'd say in some ways I was kind of lucky to be placed next to, I like where my desk is very close to the assistant principal. And so again, like that, back and forth has been really a lot of the communication, and none of it's been like scheduled or planned necessarily, but it's just it's happened that way. And then a lot of the buy-in from the mental health team has been helpful. And then they kind of going back to the administrators and saying, hey, we could also use them this way. We could also do this. We could also have we thought about this? So it's definitely evolved as we've been on campus, and like boots on the ground has been a lot of like how we've figured out what the role will look like. But I think a lot of those preliminary conversations were really important.
Yeah.
Yeah.
And I know there's a question in the chat about the 10-month position, how many weeks that was factored in hours per week. That was hours per week. So those estimates are all factored off of 33 weeks in a school year of service, figuring first week of school, last week of school. We're not going to have a lot of service going on. And it is a 40-hour work week, but it's only 4 days on campus. So it's, of a school day. So that's essentially about 24, 25 hours of work on the school campus. But I did assume if we can start billing case management at some point next year, that our Fridays where our wellness coaches are on site with us, we would still be able to create a lot of billable services because a lot of that case management will be happening on Fridays. Patrick, do you have a question?
Yeah, thanks so much. Something that came up yesterday with some of us, we were chatting, was like onboarding, like for certified wellness coaches. And I know, Tim, you had shared that you're all doing something like early in August. And I'm curious, Stephenie, as well, from your perspective, like what are the pieces around like professional development that you feel like is most crucial and like really successfully doing your role?
Stephenie, you want to kick that off?
I mean, all of it. Tim has done a really good job curating really important trainings for us. I think the restorative practices was essential. I think, we've had conflict management, we've had emotionally based school avoidance conversations. We've been included in a lot of the like love and logic things that our county's already offering to educators. And so every bit of that feels like really important pieces in the back of our mind, and we don't necessarily know when we're going to use it until we need to use it. So I think I don't know that I could point to one and say like you absolutely have to have this in order to be a wellness coach. I think you might know what you need once you're like in your school environment, because every school environment is going to be a little bit different. But I do think yeah, I don't know. I think the I don't know, Tim, what would you say? You probably have a more universal view of that.
No, I think you said it all. I like the things that we have emphasized are every wellness coach we have being trained in restorative practices. It's so that we can bring that ethic into a school campus. And as much as the school is wanting us to be a part of that work, we want to be a part of that work. But we want to bring that heart into every campus. We have, in El Dorado County, it was like a lot of yours, there's still a lot of punitive discipline happening. There's still a lot of chronic absenteeism and suspensions, and all of that is like we think bringing in that heart of restorative practices helps answer that. So that's been one we've really wanted to make sure that we're keying in on. So we're going to push into that even more next year. We've had everybody trained through our peer advocacy trainings that we've offered. So that is something we have really emphasized as a county office of ed. So we've had our wellness coaches do that. And then part of that training includes a one-day conflict resolution training so that, being able to make sure they're equipped, our wellness coaches are equipped to do that work, we think is really important. The other piece of that then is, as you mentioned, that we do have, last year we had a full week with all 26 wellness coaches in a room together, and that's working from TK all the way through 12th. And so that, we tried to find some trainings that would answer to all of those contexts. Something like restorative practice makes a lot of sense there. We'll have 3 days of that again this year in August. And so we'll offer a few different things. The other one, I guess, Stephenie, that you didn't get to go to at the beginning of the year, but we are planning on doing again this August is motivational interviewing, just to make sure there is an evidence-based practice and a skill that anybody can take and to work with a kid or a parent or a teacher. So we'll probably really emphasize that in the next year.
Beautiful. It's awesome. Thank you, Tim. Any other questions or anything coming up for anyone in the space before we close out? I do have another question, but I want to give the opportunity for other folks. Okay. To close us out, just wondering if I heard you, I know Fridays is at EDCO. Is there any flexibility based on needs that might be surfacing at the school site that would require that to shift? Or is it just standard, everybody's at EDCO?
We've kept a pretty hard line on that everybody's at EDCO on Fridays. Okay. There have been exceptions here and there. Okay. And especially here at the end of the year, we definitely want our wellness coaches to be able to go to promotion or to go to, these end of year celebrations. But we've really tried to say, no, it's important for our own wellness coaches' sanity and mental health to have some time for training, to have some time to really have space to plan and create what they're going to be doing. And it's really important for our school sites to know that they will need to learn how to manage behavior in students when staff are missing. So we've kind of taken that tack going in, like we're going to keep the hard line on that and to protect our wellness coaches and to protect, the community.
Yeah, appreciate that. Yes, thank you. Thank you both so much for your time. It was so wonderful to have you all join us today and present this information. As always, we appreciate you.